Public broadcasting awaits its fate. Hospitals in Oregon are bidding time as well, with reductions from President Trump's spending bill set to hit by 2027 and 2028. That's according to Lane County Public Health. Eve Gray, the director of Health and Human Services, says roughly a third of hospital patients in Lane County use Medicaid. Right now, there will be a small number of people impacted during the first several years of the $1 trillion cuts designated in President Trump's spending bill. Gray tells us there's uncertainty as the state prepares for an estimated $10 billion in cuts over 10 years. Gray says she expects hard-hitting penalties will fall on Oregon due to its coverage of anyone regardless of legal documentation status, as long as their income qualifies for Oregon Health Plan or Healthier Oregon.
Any disruption to the funding within our health system has the capacity to create a negative impact on healthcare providers as well as, of course, patients. That could definitely negatively impact the financial situation for our local hospitals. Medicaid does not pay the bills for hospitals. They pay about 60 cents on the dollar, but if that's better than what people can pay in a self-pay status, it puts the hospital in a worse situation.
It's also making an impact on hospitals' ability to make future financial plans, according to Gray. Mackenzie Wamid Medical Center agrees with that. Its CEO saying cuts could jeopardize its plans to build a new emergency room if 200,000 to 300,000 people in Oregon are dropped from Medicaid.
The state's going to have to do something. We have a terrible rate problem in the state of Oregon. When you got 70% of the hospitals break even or a negative margin, and we're included in that number. It's not very encouraging going forward. It could put the nail in the coffin for many hospitals. So it's a crisis. I mean, if hospitals are to survive, they would have to cut services, close down programs, which would be catastrophic.
Something Mackenzie Wamid is also considering. Butler says the hospital has already been reducing costs for years, including combining some roles. So the only step they have left is looking at cutting services. For example, what surgeries they can offer. Now, the state expects reductions in provider taxes over the next couple years, which partially funds state Medicaid. That leaves Oregon with one of several choices. Gray says find billions of dollars in revenue to make up the difference, cut people from Medicaid coverage, reduce services covered by Medicaid, or reduce payments to providers to balance the budget. Now, if you'd like to watch our full interview with Eve Gray, you can find that by scanning the QR code on your screen. That will take you to our YouTube channel. And we also have a lot of other long-form content for you there as well.